Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is unusual case of leukemic infiltration or involvement of the eye. So this is an unfortunate 9-year-old child who is known to be pre-BALL, who presented with painful eye for which she underwent inoculation. And as you can see from the scanning power magnification here, this is the optic nerve. This is the sclera, which is the pink colored structure here. This is the detached retina, and probably this is an artifact. The detachment is an artifact. And this is the kind of a brownish colored uveal tract. Here we have the choroid. And if we continue to the front of the eye, we have the iris, and this is where the focus of the lesion will be. So this is a high power magnification of the iris, and as you can see, this is pigmented because it's part of the uveal tract where the pigment is present, and this is infiltrated by small round blue cell tumor with large areas of necrosis. This is the high power magnification of the infiltrate. Typical leukemic pattern where we have sheets of uniform cells with vesicular nuclei, fine chromatin, and a prominent nucleolus in the presence of abundance, a lot of apoptosis, as well as many mitotic figures. Now, I have to say, if the patient was not a known case of leukemia, this would have been a difficult diagnosis, and then a number of differential diagnoses have to be considered, taken into consideration, including, for example, retinoblastoma with involvement of the iris, or, for example, melanoma, although she's a young child, or a lymphoma, for example, or other types of embryonal tumors. But because of the known history of leukemia, I think that the morphology fits beautifully with the history of leukemia, and this was confirmed further by immunostains, where we have the nuclear positive staining with TDT, confirming that this is an acute leukemia. Please note here the concentration of the leukemic infiltrate around the vessels. So this is angiocentric pattern of a proliferation, and away from the vessels, the tumor shows the necrosis, typical of high-grade tumors or embryonal tumors. And then the 79A, I've chosen the 79A because usually these tumors are negative for CD20. So the leukemia in general, the B acute lymphoblastic leukemias tend to be negative for CD20, and it's better to use a more like immature marker to confirm the diagnosis, and 79A is usually excellent for this task in particular, and as you can see, it's positive. However, please note that there is variability of the intensity of staining, and this is typical of the leukemic infiltrate. So we have some cells that are strongly positive, and we have some cells that are positive but showing what we call the dim or weak staining, typical of leukemia, regardless of where, of acute leukemia, regardless of where it occurs. So if we see here, for example, this is positive cytoplasmic positivity, but this is much weaker than the tumor cells that are present here. Also, a pitfall or tip that you should be aware of is that acute T-cell leukemias can also be positive for 79A. This is why you have to do CD3 in order to confirm that this is not a T-cell, but rather a B-cell acute lymphoblastic leukemia. Of course, this case is already a known case, which makes it much more easier to confirm the diagnosis. So the final diagnosis in this unfortunate child is infiltration by the patient's known leukemia of the enucleated eye globe. Now, you might wonder, why did the patient undergo inoculation? Simply because of the associated pain that is rendered whenever we have infiltration the leukemia, especially if around blood vessels, where it might even induce acute glaucoma that is difficult to be treated and would be associated with pain. Unfortunately, the only way to save the patient and to decrease or alleviate the pain is by inoculation. So remember, whenever you encounter a case where you have unusual embryonal or immature cell infiltrate in unusual location in the eye, retinoblastoma certainly is a consideration, but you have to widen up your differential diagnosis. Don't forget to include always leukemia, and while applying the appropriate immunohistochemistry might help you in reaching out the proper diagnosis. I hope you find this tip useful in your daily practice. Thank you.